You ever have one of those nagging health issues, a headache that won't quit, or maybe some neck pain you just can't shake? Well, what if I told you the answer might not be in your back, but in your bite? Today, we are digging into this really surprising connection between our mouths and our chronic health problems. It's a link that's hiding in plain sight, and we're going to unravel this medical mystery together.
You know, this whole thing often kicks off with a story just like this one. This is from a Reddit user, CallMe10, who talks about how his life just fell apart after getting his wisdom teeth out. He went from being the strong, active guy to dealing with all these awful problems. And believe me, his story is not unique. It really makes you ask a pretty wild question.
Is it actually possible? Could changing one little thing in your mouth, something as common as a dental procedure, set off a total domino effect that causes problems all over your body? That is the exact mystery we are unpacking right now.
Okay, so where do we even start with a puzzle this complex? Well, you start with the evidence. And what we have is this whole cascade of symptoms that honestly, at first glance, look like they have nothing to do with each other.
I mean, look at this list. We're talking about chronic migraines, pain that starts in your neck and just shoots down your back, even tinnitus. You know, that constant maddening ringing in your ears? Turns out that can be linked to nonstop tension in the muscles right around your jaw. It's a total puzzle. How could one single root cause lead to such a crazy mix of problems?
Well, it turns out our prime suspect might be hiding right where you'd least expect it. It's all about the hidden power of your bite. Seriously, the way your teeth come together.
Right, so the fancy technical term for this is occlusion. All it means is how your upper and lower teeth meet when you bite. But here's the thing, that simple action is the absolute foundation of how your entire jaw system works. When it's all in sync, everything's great. But when it's even a little bit off, well, that's when the trouble starts.
So how does a tiny little imbalance in your bite send these massive shockwaves through your whole body? Well, your teeth are way more sensitive than you probably think. The story really begins at a microscopic level with these incredibly precise little sensors that are built into the ligaments right around the roots of your teeth. They're called mechanoreceptors, and the level of precision we're talking about here is just mind-blowing. These little nerve endings can feel changes in pressure as tiny as 20 microns. To put that in perspective, that is thinner than a single human hair. With that kind of sensitivity, you can bet that even the smallest imbalance in your bite does not go unnoticed. So the second these sensors pick up an imbalance, they start firing off signals. And where do those signals go? They travel up the trigeminal nerve. You should think of this nerve as a massive neurological superhighway. It's the main information pipeline connecting everything in your head, your teeth, your muscles, your joints, and it all leads directly to your brain.
And from here, the trail of clues leads us directly from the jaw to the spine. If we follow these nerve signals, we uncover this powerful and often really problematic connection that explains exactly how a simple bite issue can mess with your entire posture.
This whole cascade of problems actually has a name. And fair warning, it's a bit of a mouthful. Dentomandibular sensorimotor dysfunction. We'll just call it DMSD. But the key thing to get here is that this isn't just a bunch of random symptoms. No, it's a recognized medical condition where a bad bite is the direct cause of all this chronic pain and instability. So check this out. An unbalanced bite makes the muscles in your head and neck work overtime, constantly trying to compensate. And all that chronic strain can literally pull the top vertebrae in your spine out of alignment. This puts direct pressure on your brainstem, which is basically the main information hub between your brain and the rest of your body. Not good. And what does that look like on the outside? Well, it often looks like this: forward head posture. The head literally shifts forward, out of alignment with the shoulders. This completely changes your center of gravity and puts a ton of strain on the muscles in your neck and upper back.
So just how much strain are we talking about here? Get this. For every single inch your head moves forward, its effective weight on your spine goes up by about 10 pounds. So a 3-inch forward posture means your neck is trying to support the weight of 42 pounds. That is literally like carrying a small child on your neck, all day, every day. No wonder it hurts.
Okay, so this problem is obviously complex. How in the world do doctors even diagnose it? Well, the modern investigation uses a mix of hands-on examination and some pretty cool advanced technology.
The whole diagnostic process is like a real detective's investigation. First, you gather all the clues from the patient's history. Then you get images like x-rays to see what's going on underneath. Then clinicians will physically feel around for those painful trigger points in the muscles. But often, the case gets cracked wide open with some advanced digital tools.
And this is where the cool tech comes in. Tools like the T-scan can digitally map out your bite, showing precisely which teeth are hitting too hard or too soon. At the same time, something called a range of motion assessment can digitally measure any imbalances in how your jaw and neck move. This isn't guesswork, it's real, objective data that pinpoints the exact problem.
So once the problem is identified, the focus shifts to fixing it. And the goal here isn't just to manage the pain, it's about restoring true harmony and balance back to the entire system.
The whole philosophy behind the treatment is this idea of rebalancing the big three: the muscles, the joints, and the teeth. The goal is to get them all working together again, back to their normal, healthy function, which is what provides that lasting relief.
And the approach to get there uses a bunch of different tools. First, you've got therapies you might see in sports medicine, like ultrasound and lasers, to heal those strained muscles and calm down inflammation. Then, things like electrical stimulation and manual therapy help release all that deep-seated tension. But the real cornerstone is often a custom-made oral orthotic, which basically acts as a guide to retrain the jaw muscles to find a new, stable, and much happier position.
And the results? They can be absolutely life-changing. The research shows that this combination of therapies has a really high success rate. One report we looked at cited a 93% success rate in giving patients real, lasting relief from their symptoms. That's huge.
So what this whole investigation really shows us is that our bodies are this incredibly complex web of connections. A tiny imbalance in one spot can have these massive, far-reaching effects everywhere else. It really leaves you with one final question to ask yourself. What silent conversation is your body trying to have with you?